I'm Dr. Maria Yusuf, and basically I'm an MSc Endodontics. I'm a digital smile designer. I practice onto aesthetics. I'm a certified Botox and fillers esthetician. I am a certified orthodontist. I'm a part of international DST community. That's the digital smile community. I'm a member of that. And I'm a clear path practitioner, a certified one. And I have been running a practice of my own in partnership with Dr. Munaf for quite some time there now. And basically, I'm practicing in this Bahariya branch of Munaf Dental Practice. It's in partnership with Dr. Munaf Hashim. As far as our protocols are concerned, we focus on to giving excellence. We focus on to justify treatments, what the patients require, and what should be formulated according to the patient's need and expectations. And then we mold it around with our experience, with our knowledge there, and we see what treatments we can offer to the patient, keeping all the international protocols of sterilization, diagnosis, and the formats which are present for different forms of treatment. They're all followed at MDP. As far as my lifestyle is concerned, basically I'm present inside my surgery round the clock on weekdays, and then I make it a point that I don't keep any patients over the weekend. I'm a member of a women entrepreneurial group there, so I encourage people. I am into encouraging others to pursue their ambitions regardless of whatever they are, for I believe that you strongly excel only if you are interested in what you do. And as far as you can say my hobbies are concerned, I'm more into reading, I'm into literature, and that's something that I like, which I try to take out time for also, but literature is there within me, so that's there. When it comes to how I chose the field of dentistry, I was always a straight A student. I'm basically a conventarian. I've graduated. I basically did my high schooling, you can say, from convent, Presentation Convent High School, Peshawar, and then I did my secondary level, or you can say I did my FSc from JCW, that's Jinnah College for Women, and I opted for pre-medical there. Yes, I came second in the province when it came to when it was our entry test, which was being conducted for medicine there and medical colleges. So I had an option. I could have chosen regular medicine, or I could have gone into the dentistry side, and I was roll number 1 on dentistry panel, and I was within the merit, around I think 55 was my number there in KMC. And then I decided that, see, when you're doing dentistry, you're a specialist of your own field. It's a specialty, a subspecialty. For medicine encompasses the human body overall, and oral cavity and teeth are by itself a distinct part of our body there. So that actually led me to choose, and then I was top of the line in merit. And I think today where I stand, I feel it was a very wise decision. For within my university, I stood first. I was given a gold medal for each and every professional exam other than the final year. I stood second in that, and then I was awarded the best graduate for my session in my batch. And then, as I say, once you start practicing, I chose to become a private practitioner from day one. For I believe in implementing what you learn, and there is control in what you're doing within your own terms, with your experience, your protocols, whatever you've been learning, whether on international level or at the international level. You can execute all of that very ethically and within your, with your own command when you're a private practitioner. That's why since day one, I've been practicing as a private practitioner. So, yes, there was a lot of encouragement and support by my parents, by my family. I come from a background where education was always encouraged upon. And everybody really supported me with my decision there. So, no doubt, education and academics were always given a priority. So, when I chose, and I was guided also, it was a wise decision for me to choose dentistry. And now in today's world, when I guide, the upcoming doctors who are coming to me and for guidance, for, where I come across the new generation, I tell them that, see, it's your passion, it's your interest. For dentistry today has been diversified. There are so many subspecialties there. And right from the beginning, focus towards your aim. Narrow yourself down to where your interests lie and then pursue that, for you will excel. And that's mandatory. There are so many private courses, there are so many other courses at the government level which are being executed also, and the private level. And you have to choose. Knowledge is mandatory and sound knowledge is mandatory. For that gives you ethics. And when you have all the degrees, you have all the certifications, you have all the qualification, it's mandatory that you should be practicing on to all those things which you've learned. Only then you're a sound dentist, a sound practitioner, and a justified one also, who's doing justified treatments also. For there will always be knowledge in the back of your head when you're performing a procedure. And you come across so many people from so many different walks of life. And each and every person is an individual. So here what we focus on to is formulating an individual treatment plan. Each and every patient who comes to us is special to us. We will prioritize their needs, we will prioritize their demands and whatever their chief complaint is, and we will guide them towards what is desired. Today, where aesthetics and dentistry meet hand in hand, they're going together. So at MDP, we are blending in all those parameters. We are focusing on guiding our patients and taking them towards digital dentistry. No doubt, it's expensive, very justified. For the results can be visualized and perceived by the patients before we execute. So at a certain level, we see that patients who are thinking, why to invest so much into dentistry? Why to invest so much into our treatments? And what should we expect? Their digital dentistry comes and plays a role. We can give them mock-ups, we can give them images to show them how you will look after your treatments. So there's a clear-cut difference between before and after. So there are many things. There are many things that we do over here which add to our, which makes us different. First is we don't focus on to giving patients unnecessary treatments. We focus on to what is required. We have been working for a very long time in the private sector in educating kids in schools. Time to time we are invited and we guide them, we make them very well aware why to prioritize their dental health, why to prioritize their or take care of their milk teeth. We do that. And then again, we focus on to our elderlies, we focus on to giving them utmost care and making them as comfortable as possible during our treatments over here. We focus on to catering to patients who come to us with apprehensions or previous treatments where the results were not up to their expectations, or fear factor was there, pain was involved, numerous issues. We focus on to giving them atraumatic, painless dentistry there, or dentistry where their expectations should also be met with. So first of all, I would guide our future generations, where children, adolescents, teenagers, our young adults, then middle-aged people, and then our elderly all fall in. First of all, try to understand the importance and the role that the teeth play in your mouth. And it's just not the teeth, the mucosa, your surrounding structures, your face, that holds a very important role in your body. The first impact whenever you meet somebody is where does your glance go to? You actually see a person's face there, their smile, their profile. That's the most important thing which builds up your personality. And emergency treatments apart, when you come to us in pain and swelling or any other thing which requires emergency measures, we cater to that. But the treatments which you hold on to for a very long time, or rather you don't cater to, feeling that they might not be important, they will come up, they will aggravate to such a level that later on they will start giving you trouble. So first is your personality building, then comes your health, and prioritize that above everything. For health is true wealth, I always say. And a stitch in time saves 9, prevention is better than cure. So at every level, it's nature's call. God has made the body in such a manner that nothing is dispensable. Each and everything holds its importance there. So we have to focus on to keeping you healthy, your dental health as a priority, and we can only do that if you visit the practice, if you visit your dentists. For once you are doing that, only then they can guide you within time. The importance of a 6-monthly checkup, regardless of whether you feel that you're having any dental issues or not, can never be overlooked. So give importance to that, give importance to that. And try to smile more. For as they say, smile doesn't cost anything, right? But it improves your personality, and we help you in improving your smile. Okay, now one thing where MDP differs is that we, being authentic dentists, all practicing at MDP, we encourage patients, rather it's our protocol that we ask patients to sign out onto our consent forms. That's for the patient's own awareness. Firstly, they become very well aware with the merits and demerits, the pros and cons of the procedures which we conduct. And they actually know that authentic dentists, certified ones, are going to perform onto the procedures. They sign out the consent form before the start of the treatment, and the respective doctor, whoever is conducting the procedure, will also sign that out. and that stays with us in our record there, where very few people would be doing that at the international level. So we focus on to catering to our patients with full ethical protocols there at the international level.